let me turn the panel over to Professor Phil Leaf.
Thank you, Bob. So our next panel is focusing on systems, and I just want to recap some of the things that we've already heard. One of the things that we've heard is that no time in our lifetime have assets and resources been more inequitably distributed. That we've always had inequities, but because parents are traveling longer to get to work, if you're in a neighborhood, you're less likely to see your parents almost any time in our lifetime. There's less resources. There's greater disparities between the resources between affluent schools, as we heard, early childhood programs. Now, in Baltimore, we are fortunate. We actually have some very good early childhood programs in some of our most disadvantaged neighborhoods, but it's not universal. We've also heard that brains matter, that thinking and emotions and how you respond to emotions can be modified, which means the environment matters. We heard and had an acknowledgement of the great work that Levi Watkins did for this city, this university. I think one of the issues coming back to this talk is there have been a lot of hurt people in the city. This is sort of a crash. You can be driving around, you see balloons. I mean, again, this is not an uncommon occurrence. We heard about three kinds of trauma. So there's a single incident, or there's this recurrence, or there's a pervasive trauma over a long period of time where people literally become unable to really record those things. Not because there's research on it, but I'd like to suggest that we actually may be in a fourth stage. We have a multi-generational environment here where trauma has been going on for 2-3 generations, where we've lost the infrastructures in many of our neighborhoods, the kind of assets that people were talking about that are critically important. And it's not just parents. It's the faith community. It's having good schools. It's having after schools. It's having high expectations. And one of the criticisms we often hear is we don't have very high expectations for our own children. And I think that's a major problem because what do they learn? Not to have high expectations for themselves. So we've heard about the individuals, and we've talked particularly a little bit more about the children and other things because, again, we can be working with them. We have early child interventions. But, again, in Baltimore, we actually have a lot of thugs that are crying. We have a lot of really hurt people that, they're not necessarily going to be crying in public, but they are really hurting, and they're people's nephews, nieces, sons, grandchildren. They're the people you work with. It's whether you're clinicians and working with them, or teachers, or they're in our churches. And so one of the things that we're going to hear today about is what are some of the systems. We're going to have an example of a state system, the Department of Juvenile Services, Sam Abed. We're going to hear a city system, Baltimore City Police, with Commissioner Batts, Dr. Batts, as we like to call him when he's at Hopkins. And then finally, the roles of the faith community. How are they both impacting, and what are they doing to try to transform these issues? Because, again, this is enormously pervasive, as we've heard before. Again, it's not individual incidences, although there are individual incidences. It's not just children being brought up in communities or neighborhoods or in households with limited resources. It's multi-generation, where those parents don't have a grandparent to call on, don't have an auntie anymore to call on, or don't have one that's close by who can step up. And so we need to one of the ways we change the environment is by changing the systems, by using these resources to try to both create more opportunities, but also recognize that we who work in academia, I was talking to some people yesterday, 2 days ago. This woman lost her son to violence. A year ago, she lost her other son to violence. He had been murdered. Her son that she lost yesterday has a twin. He had a twin sister. And if you know twins, she's enormously impacted. The mother's impacted. The family's impacted. And so, again, how is we community to both work on healing, supporting them, but also trying to reduce these things? How do we transform our city? How do we end those things? So with that, I'd like to turn over to Secretary Abed to be our first speaker on panel Creating Trauma-Informed Systems. And you want to come here, whatever.
Good morning. Make sure everybody can hear me okay. So, we're talking about trauma and its effect on brain development, and I got to see a little bit of your last speaker, who was very impressive, and going into things that can impact the brain's development, particularly with young children and adolescents. And that's where I'd like to get started with this. And I'll just point back to one of the graphs that he showed, which was showing brain development on a line graph going across age. And the development of a brain without any trauma is still underway into your mid-20s. And one of the things that strikes folks in juvenile justice as we start to take this knowledge and apply it to our systems of justice is that we draw sort of the arbitrary line of adulthood at age 18. Yet science is telling us that your brain isn't really an adult brain until many years later. And it begs the question, what should we do about that? And 18 is not so far away from 22 or 25, whatever it is for full development. But worse than the arbitrary line of 18 is you've got this ability to charge youth as adults, and you can have 14-year-old kids being charged as adults and being treated as adults in the criminal justice system with brains that can't comprehend what's going on and what's happening to them. So I just want to frame that as we go forward and we start looking at trauma. Even without taking any trauma into account, we do have some fundamental issues that we need to grapple with as a society. When you start to add trauma, obviously worse things can happen. And by the time a kid comes to the Department of Juvenile Services, they have experienced or been victims, either as a witness or as a victim of trauma, usually many times. And so all of the negative impacts that can befall you generally have already occurred when they come to my door. So where we start is to first try not to do any additional trauma or inflict any additional trauma on these kids. And that can be difficult to do. A lot of staff, my staff included, a lot of people that work with kids, look at them as little adults, and they physically appear to be adults. They've got, if they're men, they've got muscles, they've got facial hair, they look like adults, but as we know, intellectually, they're not there yet. So how do we not re-traumatize kids? The first way we can not re-traumatize them is to not confine them unless it's absolutely necessary. And what I'm going to go through here when I start with confinement as the first issue is what's called the developmental approach to juvenile justice reforms. And you can find some literature on this. It was the National Research Council in 2011 put out a wonderful piece called The Developmental Approach to Juvenile Justice Reforms, and it is very much a catalog of the latest and greatest in adolescent development, neuroscience, and how to apply that to system reforms. There's a follow-up piece in 2014. It was published at the end of 2014 on how you implement these systems in a system such as the Department of Juvenile Justice. And one of the tenets, or one of the hallmarks of these reform efforts, is confinement only when necessary for public safety. When you look at our systems, oftentimes you'll see language in the commitment statutes that allow or permit the justice system to incarcerate young people for their own benefit, for their protection. But of course, when you're confining somebody, I don't think you're really doing them a lot of good. So we take very seriously this hallmark of the developmental approach, which is to say, unless you are a risk to public safety or community safety, we should not use confinement. And an analogy to that, or something that really is related to it, is finding alternatives to system involvement. Because we can't just say not to confine kids. We do have kids that come to us and present problems, or whether for their community or for their families, behavior issues that we need to address, but we can find ways to address that without using the court system, without using a system of confinement. And that's the second big hallmark: alternatives to system involvement, accountability without criminalization of those behaviors. Kids will make mistakes. They do make errors. It's fundamental to their development to make those mistakes and learn from them. But if we put them in a hole so far and so deep that they cannot dig themselves out, and they're stigmatized, and they cannot then find employment or do the things that normal adults can do because of that, we're going to cause our society a major, major problem. And it's going to explode on us as those kids grow up and become adults, and then they are denied those opportunities. So we can involve kids in things like community conferencing, where you bring the kids that have done something, say they've stolen a car from one of their neighbors. Well, if we bring that kid and their family and that neighbor and many of those other neighbors in the neighborhood together and talk about what that offense did and how it impacted not only the victim but the victim's neighbors, we can use that to teach these young people what it means, how it feels to be a victim of crime. They do feel remorse, and then come up with a plan of how we can move forward and repair the community that everybody agrees to. And with this community conferencing approach, and there are other approaches to dealing with kids without using the courts, this is just one of them, but with that approach, the vast majority, the high 90% range of these kids comply with what they agree to do. And one of the advantages to doing this, rather than using a confrontational system like the courts, is that you have an opportunity for kids to show their remorse and apologize, sincerely apologize to these victims, something that they never get in a confrontational system, because it's designed to deny responsibility. You know, your defense lawyer is never going to counsel a child to admit that they did something wrong and say they're sorry, because that will assure their conviction. So they fight, they deny, and they wait until there's a conviction, and then, of course, that makes the victim even more and more unsatisfied. Whereas in this approach, we can actually get to somewhere where the victim is feeling like they were made whole again. They got an apology, which goes a long way with people that are victims of crime. And we also taught a meaningful lesson to this young person. So these are approaches that we can take for kids that are not a danger or a risk to community safety. One of the other issues that we have to confront in a system of justice is the issue of fairness. And since the beginning of the juvenile justice system, since the earliest juvenile courts were created, there's always been a bit of unfairness, sometimes more than others, because we take a very paternalistic approach to kids. And we don't give kids the same protections that we give adults in the criminal justice system. And that permeates beyond the courts. It goes into the treatment programming, the use of detention, all of the pieces, aftercare, probation supervision. There is a lot of things that are sort of unfair in how the system operates for kids. When you couple that with a kid's developmental stage and their sense, if you know young people, they have a very keen sense of fairness and will always point out anything that's unfair. Even the youngest child will sit there and tell their parent, "That's not fair. My brother got a bigger slice of cake and I want the exact same slice." Whether it's a piece of cake or anything else, kids have a very keen sense of fairness. And whether their perceptions are wrong or right, we have to be sensitive to that perception of fairness and present a system that is fair and that is perceived to be fair by kids. Otherwise, they're not going to engage in the programming that we're trying to give them. So another hallmark of a developmental approach to a juvenile justice system is to develop a fair system, not only that's objectively fair, but that's perceived as a fair system by our kids. And one of the things that is recognized as the most unfair, perhaps one of the most unfair things about our justice system, is that of racial and ethnic disparities. And we have to, as a community and as a society, commit to reducing, mitigating, and eventually eliminating racial and ethnic disparities in our system. We cannot present a system to kids. These aren't stupid people. They understand what's happening. And when they see that basically mostly black people are the ones going to jail and they happen to be a black kid, they're not going to be able to engage in that program. They're not going to be able to do anything that we want them to get from any of these systems unless we do something meaningful about that. And so when we look at fairness, we always have to look at that racial and ethnic disparity issue, and we have to commit to doing things to mitigating that. So a way that we can mitigate disparities, and I just want to say this about racial and ethnic disparities in our system. They do exist, but I don't believe they exist because of racism by police officers or racism by probation officers or by judges or by any individual decision makers in the system. Rather, you get these disparities in the data because we're human beings and we are raised in whatever environment we're raised in, and that contributes to a level of bias that we all possess. Every one of us possesses bias. And it may not be against a black person. It might be that you're biased against Italians or Irish or whoever. The point is that bias resides in your unconscious mind. It's not something that you're consciously exerting on others, but it's there. It's that feeling that you get when you want to clutch your purse a little bit closer or move to the other side of the street. You do those things because of that unconscious bias. And we all have it, and as human beings, we all cannot control for our own bias. None of us can actually control for our bias. Even if we are aware of our bias, we still can't control for it in our decision making. And so then the way to get around that and to combat that is to use objective decision making tools. We have to put structure around the decision makers so that when they are making decisions, they're looking objectively at the facts and then are being sort of forced into the boxes of decisions that they can make. An example of this is a detention risk assessment instrument. When a kid comes to intake, they have to be assessed with a risk assessment instrument, which looks at the different scores and the different risk factors and identifies whether this kid is actually a public safety risk or not. We can't let people use their gut feelings. Likewise, we've found that probation officers are actually the biggest contributors to our committed care system, which is the incarcerated system. And they contribute, I guess I'm running out of time here, I'm going to wrap this up. Either that or the eggs are ready. But they contribute to the system because of their bias. They see a kid and they say, oh, well, I think this kid just needs a little bit more and we're going to go ahead and commit him for this violation, which might be a minor violation. They start to project their own value system onto those kids, and that's what contributes to it, and it happens at every step of the game, whether it's at intake, whether it's at arrest, at a court hearing, at a probation violation hearing. All of those critical decision points are influenced by bias, and so as a justice system, we have to acknowledge that that's happening and take steps to eliminate that bias, or at least combat that bias through the use of objective tools. The last two things, and I'll be very quick and wrap up so my colleagues can speak. We have to engage families. I think family engagement is a key piece, not just in terms of prevention, but we also have to do it for kids that are already in the system. As a system, I can tell you that the Department of Juvenile Services here in Maryland has missed opportunities to use family members as agents of change in their kids' lives. Many systems miss that opportunity because they project that, oh, well, the family is actually part of the problem. They can be part of the solution. We have to engage them. We have to do a better job engaging them for that reason and for many others. I won't get into those, but the last piece that you'll find in the developmental approach, if you decide to look it up and read it, is an individualized response based on the assessment of needs. Again, we can't treat everybody the same. We have to understand what's driving their behaviors and come up with responses that will make a difference for that individual youth, rather than doing a cookie-cutter approach to either probation or to committed care. We can't just do the same thing with everybody. So with that, I will turn it over to our moderator and our next speaker. Thank you.
So our next presenter is Commissioner Batts from the Baltimore City Police Department.
Good morning. Let's wake up. We came here to learn, right? Good morning. Thank you for allowing me to come and spend some time with you and share. I have a very busy weekend that's going on here and a very busy week. Honestly, we're dealing with a crisis within our city. I want to share a couple thoughts, and I'm not coming from the position of a scholar. I'm coming from the position of a practitioner. And I don't know a lot about trauma and youth trauma and things that are impacting, and I'm going to share with you 35 years of doing police work in 3 different cities and 2 different coasts, what I've seen and what we're trying to do within this organization as we recognize that. Now, I was born in Washington, D.C. I was raised in South Central Los Angeles as a very poor kid. And I reflect on the fact that when I left my area, which people call the ghetto, and I was bused about an hour and a half to another school that was more homogenetic than what I was used to. I remember being in that school and having a teacher ask questions and me raise my hand to answer those questions, and I never got called on. You see, at my home, my mother told me I was bright, I was brilliant, I was intelligent, I could do anything that I wanted to. But when I went into that environment, I wasn't called on. I was invisible. And so that had a sense of frustration, a sense of rage. And so I became a class clown to get attention because I was invisible to people who had authority. And why I say that is I'm going to share a story with you that happened last summer here in the city of Baltimore. And as I speak, I looked off to the right and I saw Major Steve Ward there. Let's step out here, Major, and then raise your hand. And then I have my Major Kevin Jones, who's here. Step out and raise your hand. And so what I try to do is get them to as many symposiums as possible. I have them going throughout the nation to listen and to learn as we grow in what we're doing. But back to my story. Unfortunately, when we have violence that takes place in the city of Baltimore, I get called, and usually I respond out to the location, I respond out to the scene, and I want to be there firsthand to get a feel and know what's going on, what's happened, what took place, what's the interaction, if it's gang affiliated, what gangs are there. I want to know what's going on. And I also want to talk to my community members and see what's happening. On this particular incident, this was in the afternoon, I think, if my memory serves me well, it's about 3 o'clock in the afternoon, and I got a call as I was having a meeting inside the police department that a shooting had taken place. And when I responded to an area not too far away from here, there was 2 young men, and they happened to be brothers, and they were sitting in their car. And I believe they were just having a simple conversation parked on the street at 3 o'clock in the afternoon, and someone walked up on the passenger side and shot the brother in the head on the passenger side. And so when I responded out there to the scene, and as I come out, my command staff approaches me and they tell me what's going on. I ask what's happening with the investigations, and they share with me what has taken place with what they know. And usually when I go out there, that's what I'm focused on. But at this point in time, on this particular one, I stepped back for some reason. I walked outside of what we call that bulletproof tape. We call it the bulletproof tape because people think bullets can't fly from it. You guys don't get it. You're not awake yet. Anyway, I stepped away from the bulletproof tape, and I stepped away for about a block and a half, and I just watched. And I just sat there, and I watched the interaction of my police officers. I watched the community. And what I saw is a couple things, because as I was watching, my police officers were talking to or speaking with the surviving brother. And what they wanted to do, and he was obviously distraught because his brother had just been shot in the head, that he sat next to him. But my officers were focused on getting the job done. So they wanted to take him down to the station, and both my officers grabbed him by his elbows and started ushering him to a police car. And he started pulling away. And so he started to become very angry and very frustrated at that, and it was heading in the wrong direction. And so I walked up to him and I said, and I asked my officers, could you guys, let him go? And I said, I'm sorry that you lost your brother, or I'm sorry that this has taken place. And this big guy, who probably was in the game, tears started coming to his eyes because he was dealing with the pain of just having his brother shot. Whether he was in the game or not, this was someone who loved, and for us to take him in a very strong way was not being sensitive to what was going on there. So as I stepped further back, what I also saw on this day, and as he voluntarily got into the car and he said, I just want to get out of here, and we took him down. What I further saw was, on that sunny day, is that less than 30 feet away, kids were playing in the street. People were walking. Everyone was laughing. People were talking. You just had a person get shot in the head, brain matter on the streets, and this community kept going. It didn't have an effect. Somewhere along the line, we have communicated to our communities that this is okay. Somewhere along the line, we have communicated that this is acceptable. It isn't acceptable. As I was driving on Monument Street, which is right down the street here, probably about 14 months ago, the guys who drive with me on a regular basis got out to talk to some young people, casually talk to them. And as they were talking to one of them had a gun. An officer saw it. And so they got into a struggle over this gun, and this kid was waving a gun. So I get out of the car, and I go over to assist him trying to get control of this gun, and the gun is waving at some point in time. It's pointed at my chest, and I'm going, this is going to hurt. And I honestly said that went through my head, and we were able to gain control of him. At the time, I had to pull my gun, and I had the opportunity to shoot this kid. And this kid looked at me, and he didn't blink. He could care less. I ended up holstering my gun. I ended up having to strike him in the face to loosen his grip on his gun, to take the gun away from him, to take him into custody. But what I walked away with that, and I remembered, is that this kid could have cared less if he died that day. So maybe what we're dealing with in this ethnographic subculture that we have in different places within our city is cultures that have been brought up, number one, that thinks that violence is okay, that they're around it so much, that they grow up with it so much, that this is okay to happen in these communities. And that young kids don't think they're going to survive past the age of 20, 21, or 22. I started a conversation recently within this city. And I talked about racial issues within the city. And I did that because as I went to community groups in affluent areas, I had community groups, as we were talking, I said, I think we have a racial problem within our city. And the community group says, no, it started with an S, ended with a T, I won't tell you what they said. And I said, but no one's talking about it. And so I go to more troubled areas in our city, impoverished areas, and I say, I think we have a racial issue within our city. And the community says, no. And I say, no one's talking about it. What significance does that have, and why is a commissioner or a chief of police even bringing that up? Because reflect back on that story that I told you about me as a little boy. If you have communities that feel that they're invisible, if you have communities that think they don't matter to the world, if you have communities that they don't think people care whether they live or die, that has a sense of rage. And that rage expresses itself in different ways. Sometimes on people who look like me, sometimes on others. But there's simple rage there, and we're not talking about it, and we're not addressing it. Within my police department, I've been here a little over 2 years. I see the stress on my police officers internally in the organization. I see the drinking that takes place on the time off. I see some of the other issues that take place on the time off. In most other progressive police agencies where I came from, I had 2 organizational psychologists. And they were there to deal with the internal stressors, because it's not just the citizens that deal with this trauma. It's my police officers that go out there day in and day out and deal with it every single day. And both of those groups, citizens and police officers, are kind of balkanized and think that they're against each other. And they think they're not going in the same direction. Sometimes when I look at Steve, I wonder how much he's messed up, because he's been doing it a lot of years. I'm just joking, Steve. Actually, in reality, I've been doing this about 35 years, and I've been going out to those crime scenes, and I've seen some of the most horrific things that you can imagine in life. And I know it's taken its toll on me. So if it's taking its toll on me, it's taking its toll on my employees. What I'm trying to set up internally is I'm trying to ask for organizational psychologists, peer review, to allow these guys to start talking about these circumstances, to share this, to get out, to not be afraid that when you see a baby decapitated, this hurts you. It stays with you. It's not something that goes away, and it's the same things that these babies are dealing with on the streets of Baltimore on a day-in, day-out basis. And so what we're trying to do within our organization is change and adapt. Because there again, when I was at another police department in early 2000s and I was the chief of police, I sat there and I was complimenting myself because we dropped the crime rate and we had arrested a large amount of people. And I said, these people look like me that I'm arresting. And we're arresting them in huge numbers. We are decimating communities. At the age of reproduction and getting married, we're locking people up for 20, 25 years in mass arrest. We had to do a sea change and adapt how we did policing in that city and move the opposite direction. Now, I'm probably a little strange here in Baltimore because I come here and I start talking about mental health. Because a lot of the people we come in contact with have mental health issues. A lot of people who are incarcerated have mental health issues. So we have to do more training and have a better knowledge base on how to deal with that. We have to understand the trauma that kids have gone through in these communities, and I have to take a very tough, hard-charging police department and readapt it. So I've asked them to go into schools and do readings and help kids learn how to read who are 5, 6, and 7 years old. Why would I ask that? Because if a child can't read by the time they're in 3rd grade, they're most likely going to disconnect at school at some point in time. If they disconnect with school at some point in time, they're going to end up with people of their own ilk who have disconnected, and we call those gangs or groups or crews. So it's very crucial for us to focus on connecting and bringing prevention to the table and not bringing harm to the communities. So I'm shifting a culture that reads to kids, and I have 75 employees signed up doing reading to kids. Every Tuesday at 8:30 in the morning, I have a little boy named Antonio who's 6 years old, who's the most cutest thing that you've ever seen, and I think he's made a bigger impact on me than I've made on him. And that's what I want with my police officers. We have a camp at Explore. Yeah, give me a round of applause on that. Come on. We're going in the right direction. We have a camp where we bring out young people to the police academy, and we have sports for them. That's the hook to get them there, but we also build on character. Last year we did 150. This year I want to do 400. And they get to interact with police officers in a different way than they ever did before. And more importantly, we feed them breakfast and we feed them lunch. And for a number of those kids, that's the only time they're eating in that day when we come in contact with them. We are trying to change and adapt our organization to be a helping piece in this community, as conversely an enforcement piece that all you see is when we come in, we're dragging off your aunt, your uncle, and someone to jail. So we're adapting, we're learning, we're growing. It's not going to happen overnight, but we're trying to understand the trauma that this community goes through. Thank you for your time.
And our third speaker is Pastor Gary Dittman from the Amazing Grace Lutheran Church down the block.
There may be a few plants out there, perhaps you notice. And I may inadvertently go amen. Your response has to be amen. Does it? Amen? All right. So I'm a relative newbie as well. Commissioner Batts mentioned he's been here 2 years. I'm actually coming up on 5.5 years, and moved here from North Carolina. The weekend that I moved, it was August 2009, and I think that weekend there was a cookout in East Baltimore. Some of you may remember this, and there were 12 people shot at that cookout. And I quickly began to recognize that this was a community that was in distress. Amen? And, but what I also began to recognize is, you know, we have this love-hate relationship with Hopkins, as perhaps most people would know that, right? And there's a lot of people eager to be of help, but sometimes that help is related to a research project that ends on this date and this time, and that relationship sometimes gets severed. Amen? So East Baltimore has had a lot of distrust because relationships with agendas don't go very far. And that's not just true of Hopkins, that's true of churches, right? I mean, one of the things Amazing Grace endlessly deals with is the reality that there's a lot of people who have real bad blood with churches, because churches are very swift to judge. Churches are very swift to speak awful things to people who already are carrying deep burdens and great pains. So the part that I would say Amazing Grace wants to focus on in this whole picture is the healing. Right? Healing together. That's our focus. So I think it's very I mean, I've been inspired and humbled by the speakers and what I've learned. But I also think one of the things we are trying to learn, as we have a wellness center that's called the Center for Graceful Living, and is, first of all, to be a listening presence in the community. Amen? So when people come, I'm not going to prescribe them something. When people come, in fact, one of the things I love, and I see many faces from East Baltimore that I recognize, is the collaborative presence in East Baltimore, that we work together to try to address situations, that we kind of all have our own, like the Center for Graceful Living is trying to address the spiritual and the emotional well-being of folks. But there are other partners that are addressing healthcare disparities. There are other partners trying to address needs to gain access to housing and needs to workforce development. And we're all trying to work together to make it an effective collaboration. But when people come, the first thing we try to do is listen. Because most people have a real sense of being, you know, take a number, what do you need? Here. Here's what you need, take it. And we're eagerly seeking to listen. I suppose I've debated the best way to share. I suppose what I recognize about the level of trauma in East Baltimore is it's impacted family after family after family. And I thought the statistic that was given earlier about the reality that, you know, that this person thought 70 out of 100 people would be impacted, and it was 4 out of 100, reflects this great gap. Yet in East Baltimore, it's the 70, right? I've walked with people who have shared, here's where my brother was shot. Walked with people, here's where I was robbed. When I first got to Amazing Grace, I was looking through a picture directory, and I won't say the woman's name, and I won't say her son's name, but she had 2 sons that were named very close, and I thought, that is just wrong. It'd be like Antoine and Anquan, right, or something like that. And I said, I am going to give her a really hard time because of those naming her sons. And somebody said, both those boys are gone. Don't mention that to her, right? There's just a reality that people have endured grief and loss beyond my imagination. So the Center for Graceful Living attempts not only to meet some basic needs through a food pantry, and we have community gardens, and I will share something that's pretty cool, that the community gardens, we have some that are done by after-school kids, but then some are adopted by families in the neighborhood to grow food for themselves, right? And so Saturday, we had this big work day in the community gardens adopted for And there was a young man who came, and he went, Miss Jennifer, we have a environmental education person, and he came to Miss Jennifer and he said, Miss Jennifer, I want to grow things. He's probably 6 years old. It was beautiful. And she said, well, like, do you have your family? Can we meet? Can we talk about it? Because, you know, if you adopt the bed, you have to keep the bed, right? It has to be kept up, and we got to weed it, and we got to take care of it. Because, so he went and got his dad, brought his dad back. And they adopted a bed, right? There's this beautiful, the offerings, the Center for Grace Lutheran addresses those food issues, but then we also ask the community, what would help you heal? Basically, what kind of, trying to give people space to breathe, giving people opportunity to just de-stress. And basically, through surveys and interactions, we created course offerings that include things like group acupuncture or mindfulness meditation or martial arts or storytelling, creative writing, or lots of different ways for people to just have, you know, be a healing place. And we try to create a culture where everyone's welcome and everyone's accepted, right? Because we're mindful that our community is very diverse. We have practicing Muslims in our community because we have a fair number of folks who are previously incarcerated, and we have people who have unfaith in the community. And it isn't about, it's about being a healing place together. So that's all happening, and as well as there's some offerings that try to address some of that childhood things that we talked about earlier. We have a staff person, Reverend Carol Purley, who helps look deeply inside at some of the core issues of what is going on with me and why am I making the choices that I'm making, and how do I heal from that. Let me see. I was going to share a couple other brief stories. One is I'm aware sometimes we don't recognize, well, I had a person come to me and said, I'm being evicted Friday. This was Wednesday. My sister did not pay the rent, and I didn't know she didn't pay the rent. So I've been paying her my rent, but she was pocketing the money because she has an addiction issue. So I'm like, okay, well, what do we need to do, right? And he said, the only thing I need you to do is keep my art safe. I don't need my dresser. I don't need my mirrors. I don't need my furniture. But I need my art. And so we went to his house, we got the art, and we put it in this place underneath the stairway we call the cellar at the church. It's a safe place. And that was all he needed. And he worked everything else out. I didn't even have to do a referral. He worked out with his networks, with the things he needed, but he needed to know his art was safe, right? So sometimes, you know, this walking together towards healing is a matter of respect, mutuality, giving people the freedom to be authentic. And building trust takes time. It takes relationships. People aren't going, and particularly in the church, as I said, people walk in with baggage, often in the church. But we try to be mindful that the church is, that's not who we are, that there is, you know, there's no judgment here. And the last story I'll share is at the pantry. Before the pantry, we do this check-in. In fact, it's a culture of check-in all the time. At youth group, our youth ministry coordinators here, like the youth begin at dinner time with their high-lows, right? What's been high this week, what's been low this week, which is a really big deal because I'm telling you the stuff that these kids deal with, like, well, what's low? Well, I was burned out of my house this week. These are like the normals. Like it's impossible to absorb for most of us that these are the places people walk every day. But we were at the pantry, and we were doing that check-in just before we started. We were like, how is everybody? Everybody cool? Well, my boyfriend was shot and killed this week. This weekend. So this is a Monday. And so now here's what's beautiful, and here's how I know that a culture of healing is happening. Because the pantry community gathered around her, right? And one person said, my brother-in-law can help work out the burial. You let me know, because I know you probably don't have enough money for that, but they'll work with you. And someone else said, if you bring me a picture, I want to make a vase for you with his picture on it so that you can have a remembrance of him, right? And someone else said, what is it that we can do to have a repast? You need us to organize, right? So there was just this beautiful mutual healing, acknowledging, because I'm telling you, everyone in that room is carrying. We know, I mean, East Baltimore people, we know it, right? It's the norm. Yet, I do see a path towards healing and mending. And so I'm not unhopeful. I wish we could pour resources, more resources. But thank you. I'll stop for now.
Great. Well, thanks all. So we're now going to move right to some questions that have been either faxed or texted in. The first one's for Secretary Abed. As a therapist supervisor for an agency that provides behavioral health services in Baltimore City through expanded school mental health programs, I've often attempted to help clients and their families navigate through and navigate for themselves. However, I found that there's little follow-through regarding programs like SINs or meaningful outcomes or consequences provided that can prevent access to reduce future charges. Do you have any suggestions for ways that families and those who work with children and their families can better advocate for assistance once a child has entered the juvenile justice system?
All right, so navigating the juvenile justice system. So children in need of services are, for those that aren't familiar, basically are kids that have not committed a crime or an offense but have been identified as needing services. And the two systems of social services and juvenile justice in Maryland sort of overlap. And this is an area that I have grave concern about because sometimes kids in need of services get pushed to the Department of Juvenile Services, which is really the delinquency system, where they should be in the social services system. And the reason that I feel this way is not at all about, keeping our sort of players in the same sandboxes, but because once you enter the juvenile justice system, you involve yourselves with things that can become very coercive. So when a court offers assistance, it's not here, you can have this if you'd like it. It's you must do this. It's an order. It all comes through orders. In terms of navigating the system, I think persistence is the most important thing. We do have systems both in social services and juvenile services for getting to the leadership. And if you're in Baltimore City, go directly to the leadership of the Department of Social Services and tell them about the gaps that you're seeing. And the same thing for juvenile services. We have a regional director. His name is Dwayne Johnson. He's going to be really happy with me for providing his personal information, yes. But Dwayne is very responsive, and he understands his responsibility as the regional director in the city. You need to alert the people at the top so that they can make a difference. That's the best advice I can give you if you're not getting the services that you're expecting.
Great, thank you. The next question is for Commissioner Batts. What role do you see in neighborhood and community policing as part of the strategy for Baltimore?
I think the community plays job one. Excuse me, I was all choked up. I think community plays job one. From day one, since I walked in, we've built a strategic plan which tells what we're going to do and how you can hold us accountable and what my focus is. That strategic plan was built off what the community has said that they want from their police department, that their tax dollars goes towards. So what I'm trying to build is an organization, and hopefully it will last way beyond the time that I'm here, that the community directs this police department on which way we need to go. But what I've seen here, unfortunately, is that there is dramatic distrust in this city for this police department, and I mean dramatic. And there's places where there's a very deep disconnect between the two entities. And I give you, for instance, what I try to do is reach out to our critics. And anyone who's criticizing an organization, I invite them in and have a conversation, and I listen, and I try to take what they're saying and try to build that into our strategies. I've reached out to the NAACP, the ACLU, and most recently I had two very vocal advocates who are very critical of the police department come in to meet with me last week. Now here's the distrust. We had a great meeting for about an hour and a half. They shared with me what it's really like to be on the streets of Baltimore and how residents who are really on the street perceive the police department and what we need to do. But then when we left, one advocate started giving a hard time to the other advocate for meeting with me, although both of them were in the same room. And that just goes towards the distrust that's out there. But I got to break through that, and it's not going to be easy. And that's where the community has to get involved, and this police department has to get involved with the community and listen to the community.
The next question is for Pastor Gary. Often there are multiple churches, synagogues, mosques in the same neighborhood, and they seem to spend more time competing with each other than trying to support the neighborhood. What are some of the things that you see either are being done in Baltimore or could be done to really help the faith communities work better together?
So, in McElderry Park, for example, there's, Amazing Grace isn't the kind of place that competes generally anyway. We're about collaboration all the way around. However, my observation is that there's a fair number of congregations that have bivocational pastors, which means they're working full-time jobs, and they come on weekends to do worship services. In terms of ways to strengthen collaborations, I guess, I'm part of a citywide Lutheran roundtable of churches that does some strategies together. I think neighborhood would be much stronger, honestly, because you're working on the same projects, and Baltimore is a city of neighborhoods, and neighborhoods tend to have some, the problems of Fells Point's not the same as the problems with McElderry Park. So, but in the same breath, I guess, we have a strong collaboration with two churches in McElderry Park, and the other churches, I don't really view it as a pushback. I just think pragmatically the pastor and the church doesn't have the capacity to do some of that outreach, although a lot of the work we do is also community oriented, that many churches participate that. Like we had a community festival last weekend called Heal with Love, around 450 people, and there were several churches that came, as well as Micah and other healing organizations from the neighborhood.
Okay, so we had one more question. This was for actually Secretary Abed. What are you doing to reduce referrals from city schools, and how are you ensuring that the objective assessments that you've talked about actually work to reduce inequities as opposed to continue the current level of inequities?
Well, regarding to the schools, we do work with the Baltimore City school system, and they actually have made significant progress over the years in reducing the number of referrals to us. So I think that there has been significant progress made there coming from the school systems. When you look at our data, we do get more school referrals from the city than we do from other localities, so it is something that we have to continue doing, but we are collaborating on that, and there are a number of things that the school system is doing to try to address youth behavior at the school, and I can tell you that they understand keeping kids in school is far better for those kids than expelling them or suspending them. They have collaborated on a program with us called the Under 13 Initiative. When we get kids in that are at a young age that come to my front door, that's telling me that there is something going on at school or something going on at home that needs to be addressed. It's not that this kid is dangerous to the community. And so we refer those kids back as a diversion from the system. And the school system sits with social services, with mental health, and with us to collaborate on a plan. There is an analogous program that is also operating that allows the schools to make those same referrals so that they can use the collaborative effects of our agencies and our budgets for programming to address youth behavior and prevent them from being suspended or expelled, which ends up in very bad outcomes. The second part of your question was about
making sure that those assessments that you talked about aren't just continuing the inequities that you also talked about in the system.
So we do have evaluations of our assessment tools. They're not so much assessment tools as they are really barriers to penetrating the system further. The risk assessment tool that we use at detention is a fairly common tool. It's based on a model that is used around the country. The problem that we have in juvenile services is that it's not used to make the decision. And what we found through our collaboration with the Casey Foundation is that the front door, so to speak, to the detention center is not the only door that they come through. They come through many other doors, and so we actually call the report. It's on our website, the Doors to Detention Report. A risk assessment tool isn't going to make a difference in a kid that, for instance, is charged as an adult and is brought back to the juvenile system to be held there. We don't have any say in that matter. The court has already made their decision. Likewise, if there is a violation and there is court language that says, to detain this youth upon first infraction, again, we don't have any say in sort of what happens to that kid. What we do is we run the tool so that we can see how we would have handled that kid had the tool made the decision rather than one of the other decision makers in the system. We also are implementing a system of graduated responses and incentives for kids on probation, and we do have an evaluation incorporated into that. So as we implement, we're collecting data so that we can evaluate the efficacy of that program and see if we are getting the desired outcomes, which are going to be lower technical probation violations leading to commitment of our kids.
Great. So let's have another round of applause for our speakers, and as Bob comes up.